We're really, really pleased to have seen you.
I'm going to say only two things, and then I'll let you all go home. The first one's political and the other's not. When Owen was talking earlier about the guy who gave £21,000 to Andrew Lansley's office, he was talking about a guy called John Nash. John Nash, now Lord Nash, used to own a lot of private schools, now an education minister. He also, or I should say his wife, I don't want to be sexist, his wife gave £50,000 to my opponent in Hammersmith at the last election, because they thought they could buy that election, and they thought they could have another patsy MP like Hans and McLeod and Bray, who would be here and supporting the rundown of the NHS. Well, that didn't work. And thank you to the people of Hammersmith for not having the wall pulled over their eyes by the money the Tories spent then. Incidentally, someone texted me during the meeting and said the guy who I beat last time is on the shortlist of 3 for Kensington next door. Better luck there. It does make a difference. I'm really glad that Ruth Cadbury was here and spoke today, and I can say, I say unashamedly that in Alex Sanderson, in Chelsea and Fulham, and in Rupert Huck, in Ealing Central Acton, you have people who are Labour candidates who will absolutely 100% stand up for the NHS. When we won here last year, when we booted the Tories out of Hammersmith, and Stephen Cowan became the leader of the council, Vivian Lukey, who won the ward the Charing Cross Hospital is in, one day she was the vice chair of Save Our Hospitals, the next day she was a cabinet member for healthcare, and Sharon Holder, who is a member who looks after hospitals in the council, runs Fulham Broadway deep down in Greg Hans's constituency. It does make a difference how you vote. It's important how people vote. And I know there is cynicism in politics, and I know that we're all not perfect, and I at least for all. But it makes a difference who is in government and who is representing people in West London and across the country after the next election. The second thing I want to say, and as I say, with all due respect to Owen, he made a fantastic speech. The thing that touched me most tonight was when Dr. Sandhu spoke and just took it right into the heart of what it means to be, the gory details, literally the gory details sometimes, what it means to be in the heart of our NHS. Unglamorous, but hugely skilled and hugely compassionate. I went and I talked to the nurses a couple of weeks ago at Charing Cross Hospital, and they were very upset. They were very upset about the CQC report, which had found that there were failures in that hospital. Because they said to me, we work hard, we work more than our hours, we work desperately hard, we're understaffed, we're doing the best we can. We can't do much more. As if someone was blaming them for what had happened. We're not blaming them. We've got fantastic staff throughout our NHS. It's the politicians who are running at the moment, it's the Hunts and the Camerons, it's some of the managers in the system, the people who are running Imperial and who want their grand scheme, which will close down most of Charing Cross Hospital. They're the people who are the enemies, not the hard-working nurses and doctors and clinicians and midwives and care workers in our hospitals in Charing Cross So let's unite with them. Let's make sure, yes, of course we win the election, but let's make sure that beyond the election we go on, that we earn, that we get rid of that scepticism and we earn the respect by supporting the staff and the patients and the people who use our NHS. And I know that I can say that, and I know that I'll be kept on my toes because of the fantastic work Anne and everybody in Save Our Hospital has done, and all of you have done here tonight and throughout the campaign. 2 more months to go. It's a game-changing election for the country, but above all for the NHS. Let's make sure we win it. Thank you very much.